Hi everyone, I wanted to make a video because I was watching some videos about Accutane and I just wanted to kind of share my story. It's kind of an interesting story. But I started having acne, quite a few years ago, and about 2 years ago during the summer it just got really, really bad. It was to the point where nothing helped. I tried every single acne product on the market. I don't, every single antibiotic that they had. Dermatologist, she gave me topical stuff and nothing ever helped. I mean, I'm the epitome of trying everything, even proactive and that sort of thing. But so finally we decided to go on Accutane, and I was really nervous about going on it because my dermatologist, she told me so much about the fact that it would make your acne get worse for a while, and it was already bad enough, so I really didn't, I didn't want to do it, but I know that I needed to, and I really need to get rid of it, or it might be there for the rest of my life. So I didn't have acne completely like covering my face, like little blotches. I had like really, really big pimples. Like they would be up here on my forehead, and they would be down here, and every once in a while I might get some on my nose or something, but they were just big bumps, and they hurt really bad. They weren't cystic, like the non-curable kind, but I mean, they were about as close as it gets, and they just hurt and itched, and it was the weirdest thing. We thought it was an allergic reaction for a long time, but it wasn't, sadly. So, we finally got on it, in last summer, and, my dermatologist, she gave me a prescription, of a drug that was supposed to kind of, help inflammation for the first couple of weeks because it was going to get bad. And, she told me about all the side effects that could happen. And so I got on it. And first couple weeks it wasn't too bad, and then I probably hit, around a month, and I started getting absolutely terrible breakouts. They were just, I mean, didn't want to come out of my room, didn't want to go anywhere. It was just bad. I'll show you a picture. It's kind of embarrassing to show just because it really is bad, but I mean, I've seen people put, their pictures on YouTube, and so I guess if they can do it, I can do it, and hey, if it helps someone, that's great. But I'll show you the picture. So, it's not very pretty, but that's what it looked like, probably about a month, maybe a month and a half in. And, I mean, it was just bad. I don't know how to say it. Everything was painful. Everything hurt. I could not probably touch my face. Makeup, it didn't put a dent in anything. At that point, I just wanted to sit and cry every day. But, I started having a lot of symptoms. I had really bad headaches every day. They would not go away. They would be literally all day, and I would try Excedrin, Advil, Tylenol, everything that we had in our medicine cabinet, and they would not go away. I never had one go away, and it was really bad. I had really bad dry skin. Probably towards the 2-month mark, my skin was so dry that it would literally flake off like the weirdest way because I would have oily skin, and it was so dry. I could not use anything with salicylic acid or peroxide in it. I used amino, like hyperallergenic, like no soap wash and moisturizer every night. But my skin still peeled like crazy. Almost sort of wasn't worth putting makeup on. My lips got pretty dry, but that was not the worst part. And then my nose, like right inside my nose, just I would get like scabs almost, and they would bleed sometimes, and it was kind of nasty, but if it gives me better skin, I guess I can live with it. But the headaches kept getting really bad, and about probably around 2 months or 2.5 months, when I went back to my dermatologist for my checkup, she was really concerned about that because they wouldn't stop, and I would feel terrible all day. And so she was scared that I might have something called a pseudotumor, which happens in your brain, and apparently it can make you go blind if it pushes on your optic nerves. And so she was scared that was possibly happening, and she wanted me to stop taking it because, she didn't want me to go blind. So she sent me to the eye doctor, and they didn't see anything, but it's not always possible to see it, and it could definitely still be there if they didn't see it. But she still felt like it was best for me to get off it for a couple of months. She said that I might be able to have some results now that I'd taken it for a good 2.5, maybe 3 months. Just kind of, ride on that little bit that I had, and maybe later come back to it because, some of it would still be there. It wasn't like I had started from the 5 months. So she went ahead and put me on spironolactone, which is kind of similar to Accutane, not near as many of the side effects. like I said, it's kind of the same, but she said she had a lot of good results with her female patients, so she gave it to me. And I don't know if it's either been the spironolactone or the Accutane that I had working, or both of them together, but now I really don't get a lot of acne at all. I have little bumps. My skin is very scarred, sadly. Up here, my forehead, if you can see in the light, I've got little craters that, you know, happen with the acne, and I guess I always have them. Every once in a while, I'll get a couple pimples. Usually, you know, it's not very many. It's not bad. Probably the worst thing is my scarring, but I would say to anyone who decides to try Accutane, go ahead and do it. I mean, I had really good results with it, even though I only had it for about 3 months. I have not had pimples since, hardly, and that's a huge blessing. I mean, scarring sucks, but hey, if you don't have acne anymore and you had it really bad, you know, you definitely have a possibility of getting rid of it. Maybe not having to go back on it. You know, the blood tests and everything, they're worth it. Just make sure that, you know, you monitor your symptoms and just really know what's happening. And if anything happens, let your dermatologist know, because you don't want to go blind. And like I said, try it. I've had really good results. This is almost without any makeup. You can see in the light that I really don't have any pimples anymore. It's a lot better than that picture. It's a really, really hard ride if you start it. The first, you know, 3 months, if not 4 or 5, are really hard. I would say do it maybe during summer or winter break. I mean, just a little bit to where maybe you're not in school. It's just, you know, expect it to be really hard, but expect really good results, and I would definitely recommend it. I'm pretty happy with the way my skin turned out, so I hope it stays this way.